Hello. In today's video, we'll be addressing the differences between the common cold and the flu. The overall aim of this video is to address this because I've seen so many patients come into the clinic and refuse the flu vaccine, with their number one reason typically being that they still got the flu after the flu shot. In fact, they would even go as far as complaining that the only time they got the flu was after the shot. But in this video, I'm hoping that I can debunk some of these worries as well as explain some of the differences between both the common cold and the flu. So starting out with some commonalities between both. Both the common cold and the flu are viral infections, but they're typically caused by different viruses. They can also present with some similar symptoms, and both of these are infections of the upper respiratory tract, hence why they are referred to as upper respiratory infection. The upper respiratory tract, also known as upper airways, consists of the nose, the mouth, the sinuses, the pharynx, which is the upper section of the throat, as well as the larynx, which is the voice box. Whereas the lower respiratory tract consists of the trachea, which is the windpipe, bronchial tubes, and the lungs. Therefore, upper respiratory tract infection refers to an infection of the respiratory airways anywhere above the trachea. The infection of the nasal lining or epithelium of this upper respiratory tract triggers an inflammatory response by the body's immune system, resulting in increased nasal blood flow and increased dilation of the nasal blood vessels. This ultimately leads to runny nose, congestion, and postnasal drip. The occasional sneezing and coughing is also a result of irritation of the upper airways. Now diving into some of the differences between the common cold and the flu. The common cold is the leading cause of outpatient visits in the United States, and it can be caused by a bunch of other viruses during the fall and winter season, with the most common culprit being the rhinovirus. Other viruses that could cause the common cold include parainfluenza virus, adenovirus, and then for the flu, the most common culprit that causes the flu is the influenza virus, hence why it's referred to as the flu, because it's typically caused by the influenza virus. The flu typically results in more systemic symptoms. Therefore, symptoms such as fever, chills, body aches, fatigue, headache are typically more common with the flu. The symptom onset with the flu is also typically more abrupt and sudden. Symptoms such as cough and chest discomfort are also more common with the flu, whereas with the common cold, the symptom onset is more gradual. Systemic symptoms such as fever, chills, body aches, fatigue, headache are also rare or uncommon. And then symptoms such as sneezing, stuffy nose, and sore throat are typically more common with the common cold. The flu can be diagnosed by a PCR test, but majority of the time, both the flu and common cold are diagnosed by clinical symptoms alone. In regards to the fear of still contracting the flu despite getting the flu shot, there are multiple explanations that I can come up with. One is the lack of understanding of the differences between the flu and the common cold, which hopefully this video has helped to cover and address some of those differences. Also, there are four main types of influenza viruses: influenza A, influenza B, influenza C, and influenza D virus, with influenza A being the culprit for majority of the flu outbreaks. Within type A, there are various subtypes, and they are constantly mutating, making it difficult for a flu vaccine to cover every single variant that there is. With the constant mutation each year, that is also why we need to update our flu vaccines every year to ensure adequate coverage for the most common strands of the virus each year. Finally, the vaccine also takes about 2 weeks to be fully functional, which is why it is recommended to get the vaccine early in the fall season before the peak of the flu season, to ensure you've given your body enough time to mount adequate immune response if exposed to the virus. Comparing that to an individual who gets the flu vaccine very close to the peak of the flu season, not giving the body enough time to mount an adequate immune response, and then ultimately ends up getting the flu because they didn't give their body enough time to mount an immune response. So those are some of the explanations that I can come up with for why individuals tend to feel that the flu vaccine fails them. In regards to treatment, both the flu and common cold are viral illnesses. Therefore, they cannot be treated with antibiotics, which are typically given for bacterial infections. In regards to the flu, there are some antivirals for patients with severe infections, patients at high risk of complications, or patients with confirmed flu infection within 48 hours of symptoms. But these are typically up to the healthcare professionals to decide whether to prescribe an antiviral or not. Most treatment measures typically include supportive therapy such as oral rehydration, over-the-counter medications for pain and fever such as ibuprofen and Tylenol, but it's important to note that aspirin should always be avoided in children. Symptoms usually resolve by themselves after about a week, and it is also imperative to take adequate measures to prevent spread of infection to others by practicing adequate hand washing, mouth covering while sneezing or coughing, wearing a mask in public places, as well as staying home while symptomatic if possible. So in summary, both the common cold and the flu are typically caused by viral illnesses, and they have some common symptoms amongst them. But the common cold typically presents with symptoms such as sneezing, cough, and the symptom onset is typically more gradual, whereas the flu, which is caused by the influenza virus, is typically more abrupt in terms of symptom onset and typically present with more systemic symptoms such as fever, fatigue, body chills, as well as body aches. Treatment measures typically involve over-the-counter medications for pain and fever, as well as adequate oral rehydration. It is also imperative to take measures to avoid the spread of infections to others. Thank you very much for taking the time to watch today's video. I hope it answers any questions you might have had prior to watching, and I hope you have a great day. Bye.